Has anybody experienced any kind of pain in the neck or headaches in the past few days? Okay, and we're gonna start with you. Where have you kind of experienced the headaches? Do you have one-sided pain, two-sided pain at the forehead, jaw pain at all?
I have them all over. We start from the spot up in my upper shoulder, but you can turn my neck. I've had 3 of those.
Oh no, okay.
People, I would prefer to talk to you face to face. They want to talk to that.
Yeah, for sure.
So I've got with my neck. It's quite. I'm very when I turn my neck. I usually like to turn my body.
Alright, and have you done anything to kind of manage your pain?
Oh yeah, I mean I've been on migraine meds, and see a chiropractor as needed.
Okay, good. And anybody else? Yeah, go ahead.
Mostly jaw pain up in the ears, up towards the back, and pretty much chronic tonight.
Okay, and what do you do to manage it?
Advil, but little stretch in the hand.
And do they help?
And I have when it gets really bad or it affects my hearing, I have a prescription muscle relaxant.
Okay, and you?
So I get migraine.
Right.
Since I was 15. I also have neck pain here, which makes it at times difficult to on my left. So I have a migraine medication, and I see Daniel from the side.
Okay.
Because we're trying to get this loosened up, whatever it is. I did see a chiropractor for like about 4 years.
Okay.
So maybe it's changed. That was
Yeah.
a while ago.
Yeah,
And
for
I
sure.
had 2 ones as well.
The forehead on both sides, right?
We ran.
And the round. Okay.
And, like I have one now, just a half of it.
Okay, so we're gonna actually talk about that today. So neck pain actually stems from irritation and damage that are in the structures of the neck, such as your joints, muscles, ligaments, tendons. As you can see in the picture here, we have surface level and deep structures in the neck, and damage and irritation to any of these structures that could basically lead to neck pain and headaches. There are different causes for neck pain. One is poor posture, prolonged sedentary positions. We see that a lot today, these days, with basically patients working from home, our office workers, our students, lack of mobility, muscle imbalance, usually due to improper endurance and strength, and sprains and strains due to injuries, and repeated micro trauma from daily life demands, and also degenerative conditions such as osteoarthritis, which is a normal process of aging. So I'm sure we're all guilty of being in these positions at some point, reading on your back, texting on your back with your neck bent, holding the phone with your neck bent, and kind of slouching forward to read the computer or work on the computer, and all of these postures obviously lead to discomfort and neck pain. I want to go into more detail as to how posture relates to neck pain and headaches. As you can see, this posture is the proper posture, whereas the next posture, this is a person with an improper posture or something, or basically someone as we refer to as upper cross syndrome. So there, as you can see, the neck is protruded forward, there's rounding of the shoulders, and the back is curved, and this is because of basically a bunch of muscle imbalance in the front of the neck and also the back, and it could lead to the dysfunction in the neck joints, tension in the muscles, and as a result, neck pain and headaches. Now we're going to talk about headaches. As you can see, we have there are different types of headaches with different causes, and they all look slightly different from each other. Today we're going to talk about the most common types of headaches that we see in practice, which are tension type headaches, migraine type headaches, and cervicogenic headaches. Starting with the cervicogenic headaches, so these kind of headaches start at the back of the neck and they kind of move forward towards the skull. And again, these headaches come from irritation in the joints and the structures of the neck, again, the small muscles. And they're usually aggravated or get worse with neck movements, and they're also accompanied with neck pain. And again, treatment of the neck definitely helps with treating and relieving these symptoms. The next type of headache is tension type headaches. These headaches are basically located at the forehead on both sides, and they start mostly at the back of the skull, and due to tightness in the four basically small muscles that attach to the skull from the neck. And again, the patients describe the pain as tight and squeezing headband, and they're triggered by different things such as emotional stress, fatigue, caffeine, cold, lack of sleep, and poor posture. Again, in terms of treatment, targeting these deep muscles really helps with alleviating the symptoms in that region. Next headache is migraine type headache. The most identifying factor for these kind of headaches is the kind of pain that patients experience. And pain is usually described as pulsating and throbbing. And they're usually one-sided. They can shift from side to side. They're experienced from at the temporal region, behind the eye, and also the forehead. And again, patients can experience only the headache, or they can be accompanied with different symptoms such as nausea, light sensitivity, sound sensitivity, and they can be triggered by different things such as different scents, usually cheese, wine, chocolate, or hormonal changes, poor posture, alcohol, and lack of sleep. So this is a summary chart of what we just talked about. You guys also have a copy with you. You can go through this chart to see what kind of headache you've been experiencing, and if you have any further questions, you can either ask me at the end, or you can book a free consult with me and we can go through it in more detail. Next is management. So what can you do about it? There are certain things you can do at home to help alleviate the pain, and there are times where these strategies are not helpful, and that's when we come in as practitioners. So what you can do at home is basically exercise. You can use heat, self-massage, being aware of your posture, and having a good ergonomic setup. So we're going to go into more detailed. We kind of talked about it in the beginning, but this is the upright posture, and the adjacent picture is kind of a patient with the slouch posture. Usually patients ask us what's the best posture, or they ask us if the upright posture is the best posture, and the answer is actually no. Best posture is the moving posture. You want to be moving all the time. You want to be moving your joints, increase circulation to the muscles, decrease tension, and as a result, decrease the creep that could lead to neck pain and dysfunction. Next is having a good ergonomic setup. So if you're seated and you're working on the computer, you want to make sure you go all the way back on the chair. As you can see on the top, our spine has 3 different curves in the neck, in the upper back, and in the low back. And you want to actually maintain these curves, because if these curves are disrupted, it leads to again, dysfunction and pain. So what you can do is, again, go back on the chair and roll a towel or put a lumbar support on the chair to keep the arch of the back, and you want to tuck yourself in all the way into the desk, and your knees basically have to be at 90 degrees, your arms should be rested, shoulders back, and screen should be at eye level in order to minimize discomfort. And obviously exercise is stretching, motion is lotion. So basically you want to make sure to personalize the exercise based on your ability, your age, your previous injuries. You want to keep them simple so you actually get to do them, and you want to be consistent. And stretching. So as you can see here at the top, the shoulder muscle, the upper trap muscle, and the left scap muscle, which is basically where it attaches from the base of the skull to the neck. These are the most common areas where patients actually experience tightness. So so I'm going to go actually through a few common stretches we prescribe to patients with neck pain, and it helps a lot in terms of reducing the symptoms. So the first stretch is actually the Brugger's stretch, the upper trap stretch, sorry about that. So we're going to actually do it together. So you guys, you're going to have to place your hand under your thigh. Perfect, exactly. You're going to bend your neck to the side. You're going to hold this stretch for 10 to 20 seconds. Yeah, you can actually hold on to the chair if you can. Yeah, as long as the shoulder is kind of depressed. Good.
Is it to the side or a little bit forward?
You're going to bend it to the side. For this one. You're talking about the next one. For the next stretch, it's technically the same thing, but instead of bending your neck to the side, you're going to look towards your underarm and you're going to push your head forward. And you're going to feel the stretch at the back of the neck. Feel it?
Yes.
Good. Again, you want to do it bilaterally on both sides. And again, within pain limits. Based on evidence, in order for stretch to be effective, it actually has to be held for up to 30 seconds. But if you're experiencing pain after, let's say 15 seconds, you want to stop there, and then as your tension goes away, you want to gradually decrease the time to 30 seconds or a minute or to a minute. The next stretch is the Brugger's posture relief stretch. Again, with this stretch, you want to kind of have your back straight, push your chest forward, your arms go to the side. You're going to bring your thumbs upwards and you're going to squeeze the shoulder blades together. I just heard a crack in my back. I don't know if you did. But this basically just reverses the flex position in the spine. And you can just relax and then do it again. Again, this is a very good exercise for patients who are seated for a long time. All right. So, there are times when self-management strategies that we kind of went through together right now are not enough. They're not enough to alleviate the pain, and that's when we come in. When there is severe pain, there is constant pain when patients are experiencing severe headaches. That's when basically booking a consult or an assessment with a practitioner is important. We're going to go through a very thorough history. We're going to do a physical assessment to really understand why you're experiencing the pain. And then we're going to come up with the best treatment plan for you that is individualized and it's effective and it's something that you're comfortable with. So now I'm going to talk about how chiropractic can help with neck pain and headaches. So chiropractic basically is a combination of manual therapy and rehabilitation. With manual therapy, we're going to work on the joints that are restricted or injured, or the muscles that are tight and tender to kind of relieve the tension in that area. We use a couple of different techniques for that. We use our hands, so manually, or we do something that's called cupping. So cupping works reverse to deep tissue massage. With deep tissue massage, you kind of put pressure on the tissues to relieve the tension, whereas with cupping, you place it on the area, it pulls everything upwards, increases blood flow to the area, and with dynamic cupping, so we basically lubricate the area, move the cup up and down, and it separates the muscle from its covering that usually causes tightness, and it's really effective in terms of reducing tension. Another tool that we use is the Graston tool. It looks like a heavy butter knife, and what we do is that we scrape it along the tissues, and it again breaks down the fibrous tissue, the adhesions that form in tight muscles, and helps relieve pain. Another effective method is electroacupuncture. So acupuncture is the insertion of needles to the areas, the problem areas, basically, or areas that are injured or basically tender, and we connect. We can either do acupuncture or electroacupuncture. I personally like to do electroacupuncture because it's more effective. But what we do is that we connect the needles to electricity, and the electricity goes through the needle, through the tissues, and it actually contracts the muscle. You can actually feel the muscle moving. And what it does is that it stimulates the nerves and muscles that innervate the subclavian area, which helps with improved function. It also decreases, it basically desensitizes the nerves that are responsible for passing pain, so patients experience less pain after acupuncture, and also reduces tension. And as well, so there's many good things about acupuncture. And then obviously rehab. So rehab is basically exercise. I always make sure to give 1 or 2 exercises to my patients before they leave the session, either mobility, stretch, or strengthening, because we are able to kind of relieve the pain and dysfunction after a few sessions of manual therapy. But unless patients are consistent with these exercises that we give them, the pain is going to come back, because we're trying to target the cause of the problem. So pain management and rehab is very important, and we also work on the joints using gentle mobilizations and manipulation. Again, I treat all my patients differently. Some patients like acupuncture, some patients are scared of needles, some patients prefer adjustments, some don't. So that communication is very important in the beginning. We make sure to do something that's not only effective, but it's also something that you're also comfortable doing. Again, I have, so that's a manual skill, acupuncture, and I have a picture of cupping as well. There we go. And
So that leaves big bruises.
exactly. But I actually like to do dynamic cupping. So with these cups, you can either leave it on one area, or you can kind of lubricate the muscle and move it up and down. When you move it up and down, it prevents blood flow to kind of accumulate in one area, which as a result prevents bruising. So I like to do that. It's as effective. It doesn't really change in efficacy. It's just, I prefer not to have bruises, so I do the same for my patients. And yeah. What's that?
I said, I'm going to. There's changes since I last saw a chiropractor, so.
Yeah, for sure. You can book a consult with me or an assessment, and we're gonna go through everything together. Any questions? Any concerns? Any comments? Does everything make sense?
Yeah.
Yeah? Okay.
I know my posture sucks, so. Because I work in a call center, but at home.
Right.
So it's 8.5 hours a day, and you can't get off.
Yeah.
calls, right?
Yeah, so having a good ergonomic setup is going to be really important for you.
Well, I did better, I retired.
Yeah.
So I don't have to worry about it anymore. But the damage has been done too,
Yeah.
so I need to.
It's not too late. It's not too late to, yeah.
Because I have constant migraines and constant headaches, so I need to
Yeah.
get rid of those.
Yeah. I actually have a patient with mixed type headaches. So basically she had, if we go back to the picture that we kind of went through.
Yeah, I get the both, the tension and the migraine.
So so you can either have one headache, or you can have a mixture of all the headaches. And the treatment for that is a bit different, but it really helps with the frequency of headaches and also the intensity of the pain that each time they experience.
Okay. Well, I'm gonna come see you, so we'll.
Sounds good.
So then you can prove it to me.
For sure. I'll be happy to. Any other questions?
Ma'am,
Yeah, for sure.
does anyone have headache now? Just
And so mine are,
So-
it's one that you didn't list with the migraines is weather related.
Weather
So
related,
when
yeah.
the barometer shifts.
Yeah, for
and
sure.
you're going back and forth rapidly, so it's
Yeah.
ready for me.
So
Yeah.
based on the doctors you categorize, what do you think your headache is?
Oh, it's right across the back of my head.
No, she was categorizing that headache can be tension headache,
Yeah.
right?
Mine now is
tension
migraine.
migraine or your neck has anything to do with it as
Oh, it
well?
probably has a lot to do with it.
So it could be a
It could be a combination, but normally I'll get migraines either across the back or one side.
And you currently have a headache?
Yep, across
Okay,
the
now
back.
where is your headache now?
Across the back.
0 to 10, what's your headache number?
Probably about 5.
About 5?
Yeah.
Okay. And can we do, you take that, may I?
Yeah, of course.
This is I'm lazy, so I didn't prepare anything.
Oh, it's okay.
I'm just going to go off.
It's okay.
My Dr. Jooya has prepared. So when you have a headache, I'm going to, as a physiotherapist, and chiropractors and physiotherapists are very similar to each other. One of the techniques that I almost always show to my patients with migraine is this technique, and I want you to try it. It's very safe. It's something that you can do at home. It's something that you can do anytime that you have headache. Okay? I want you to have 2 of your middle fingers together. Here, find the bone, right, the last bone that you can find. And you can find it, if you slide, you can find it here. These 2, they go together, just like that, okay? And then bring your elbows to each other, okay? And as you press forward, tuck your chin in. So bring your elbows as close as you can and as low as you can, and then go back. So you're basically pushing forward as you're tucking your chin. There. And we do this 5 times together. It's safe. There is no way that you can injure yourself, even if you do it wrong. So look forward, straight forward. So don't bend your neck. Straight forward, nose forward, and then do that. 1, 2, 3, 4, 5. We'll do it one more. 1, 2, 3, 4, 5. How does that feel?
It actually increased the ache
Increase the ache. The ache in the
Yeah.
area or the pain?
across the back.
Across the back. You,
Yeah.
gentlemen, did you do that? Did you do that?
Do what?
This movement?
Yeah.
Did that change your headache at all? We don't expect
I
miracles
feel,
on
I
this.
feel the pressure there.
Mhm.
I've never tried poking that spot before, so it's.
Yeah, it's not okay, it's just moving that.
Yeah, that's sore. It's,
So the reason you're actually feeling an aggravation in that area is because of this,
Yeah.
you're pressing on these muscles here, and we already know that your pain is starting from here, but that's actually a way to relieve the pain. So this is actually a treatment technique called trigger point release. You want to actually press on the areas where you have tension. It does aggravate the symptoms temporarily, but that's the way to basically treat it.
But that shows that when you do have something going on in the neck, you can actually activate the headache
Oh, yeah.
or release it as well, right?
Yeah.
Because I know when I get my massage, it sometimes will trigger a headache because of the increased circulation,
Yeah.
and then it eases off.
Yeah.
Yeah.
You said find the bone back here, but I think I have so much knots that I can't tell. You might need to give my neck a poke so I know
Yeah,
where
that's where we come in, so we can actually find it, we can help you to locate the bone.
It all feels like bone back
there as well.
Yeah, that's why I'm finding.
Yeah, I'll tell you a story. My ex-husband, when I started dating him, he had headaches, severe headaches, and he, in anticipation of headache, he would always take a lot of medication, always. He would not leave the car without his Tylenol and all that. So anyways, we had a chiropractor and we had him to see the chiropractor, and I myself treated him at that time as well. So over like a period of 6 months, his headaches were like significantly less. And in the meantime, I gave him a pillow as well as the pillow. To this date, he still thinks that all his improvement is because of that pillow. So instead of taking the Tylenol with him every time, he now takes the pillow with him in the car. So, but it's just something that doesn't matter what works, but as long as you do not have the headache. And it was mainly the chiropractic treatment that actually gave him the relief that he has. He still does the exercises and everything. So between one of the questions that I'm asked and you may have is that what does a physiotherapist do for headache that is different from what a chiropractor does? Does anyone have any idea about that? Have you seen physio and chiro and then compared?
I've done the whole 9 yards. And I find the one thing that my chiropractor does is, when it's really bad, is he knows me well, so it's like, usually try to find something that doesn't hurt.
Right.
Yeah, but he'll press on a certain spot and he'll hold it, like he'll put pressure on it, hold it, and release it to the count of 5 or 4. And it's like, you hold your breath and then you slowly release it. And I've actually done that to friends where they've got headaches and they're like, don't know, because they figure I'm going to do a chiropractor. I said, no, I'm not a doctor, I'm not a chiropractor. I just know that this is something that will assist. And they always say like, oh Marie, come back, can you, because it's just that pressure point and just relieving it. But when I've gone to physio, they've just kind of massaged the area, and it usually really helps. Like, sometimes it's too painful, but other times, depending on how they do it,
It's very
makes a
similar,
difference.
in my opinion, what we do and with our chiropractors do. Obviously, they are trained in adjustments and the higher level of mobilization and manipulation that physios are not. So some patients, they really benefit from that. But in most cases for headache, physios and chiros basically do the same thing. Especially older versions of chiropractors, they didn't do much exercises, but now all of our younger evidence-based chiropractors, they do a lot of exercises, which is very, very similar to what a physiotherapist does.
Like with migraines, it's usually starts like in the morning, or like you even don't have any headache, but you already feel like you're a little bit nauseous and you're not actually more energy level in the morning. When to come, like for this kind of treatment? I mean, if you have, like recently my doctor prescribed certain pills that are really helping, but you know, it's not good to always take pills.
Yeah, for sure. So what pain medications do is basically just masking the pain.
Yes.
And you're not really targeting the cause. So when you do experience the migraine type headaches, you can definitely come for an assessment and can figure out if it's actually migraine. Because it could not be, it can be something else. Usually actually I do have some patients that have restrictions right at their basically C0, C1, which is where the skull attaches to the spine. And restriction in that area also causes headaches. So it's very important for you for us basically to do the assessment to really understand where it's coming from. Do you have like you mentioned having nausea, and do you have any sound sensitivity, light sensitivity?
Yeah, it's not sometimes I have blurs around my eyes, but
Okay.
I turn hard and like I feel I don't feel headache, but I really see my vision is blurred, so I know that it's going to start.
Right, and you're usually experiencing it in the morning.
Not exactly. Like in the morning, I already feel nauseous. I don't want to eat anything. I don't kind of weak.
Right.
I'm forcing myself to go. Then I go to work. I do things, and then I feel like okay, there is a blurry.
Do you have a headache as well?
And then
along
I
with
have
the-
headache, yeah. I have like minor headache and in the back that I feel, but at the end of the day it can be devastating, like
Yeah.
really dying.
Yeah, I mean, we can definitely do an assessment. It's very hard to specifically target without knowing your past medical history, what's going on. But we can definitely go through that and I can give you a better answer. Because I have to assess you, I have to know about your past medical history, I have to know what the triggers are, and do you have like any kind of sense that's aggravated, do you feel dizzy at all? There's more to it, for sure, you know?
My question maybe is like when to come. I mean, for example, if you don't have headache, should I go for physiotherapy? Like it's preventive or it is something that you need to do the day you have headache?
No, you can actually come for an assessment and you can just tell us how often you've been experiencing the pain, and we can still do the assessment. We can still go through, all the questions that I have to ask you and come up with a treatment plan. We actually have a lot of patients on maintenance care, so to kind of prevent pain from happening. So maintenance care, especially for those patients who are prone to experiencing neck pain and headaches, is very important. And usually with our own patients, we start with a more frequent kind of type of care, and then we decrease the frequency as we educate the patient more. Because the best patient is the educated patient. You want to give them all the tools they need in order to manage their own pain better. But again, that maintenance care, just getting having your teeth clean, it's good to make sure everything is nice and aligned, and you are basically in a good shape. Yeah.
Dr. Jooya was asking, do you experience dizziness as well?
I do experience business, but not at the times I have.
It doesn't necessarily. There is a condition called vestibular migraine.
Okay.
That vestibular migraine, you do have symptoms, as you're saying, of that. It doesn't necessarily have headaches, and it doesn't necessarily have dizziness at the same time. So I would suggest to discuss with Dr. Jooya first, and then maybe we can look into that as well.
Yeah, there are many different types
I
of.
do have, sometimes I'm dizzy, especially in springtime, when I do a lot of physical regimes thing and biking. I have to find.
Yeah, migraine, vestibular migraine is actually very common, and many people do not know it. And many doctors, they do not differentiate it as well, because they always associate migraine with headache. It's not necessarily always a headache.
Yeah, so if you're not responding to those self-management strategies, it's definitely a good idea for you to get it assessed. Yeah. Some patients experience headaches with high blood pressure. Again, it's very important to kind of assess that and rule it out and make the appropriate referrals.
Yeah, many times patients, one of the ways that we can actually differentiate the type of headache is that what time of the day they do experience headache. There are certain patients that they do not have any headache most of the time in the morning. They wake up, they're fine, and as the day goes by, the headache starts coming. And those type of patients are typically the ones that they have muscular weakness. The neck is very weak, right? So this type of patients with some treatments that they will see, the exercise portion of their treatment is a lot more important, and many of them will get significantly better. On the other hand, we do have patients who wake up with headache, and during the day, the headache almost all the time goes away. Dehydration is also a very, very important factor in headache. So the patients who wake up with headache, and as they move, the headache goes away, there could be a muscular component to it, and also the way they sleep is going to be a condition. So these are the things that during the assessment, either a physiotherapist or a chiropractor will get. That's why that assessment, the discussions, and the patterns of headache are very, very important in guiding us to what type of treatment this patient will benefit most from. So sometimes I don't know what's your idea about cervical pillows or anything.
I actually had a patient yesterday, and she's been experiencing neck pain and headaches for 2 years now, and she's been receiving, consistent treatment, and she hasn't still gone, there's no relief of her symptoms. And I had to go through a very thorough history with her to understand that the problem was basically just her pillow. So it's very important to use the right height of pillow to, sleep ergonomics are very important. Usually, so you talked about experiencing more pain in the morning. Usually patients that wake up with more pain in the morning, the pain is actually coming from the pillow, from the way they're sleeping. You want to have, we talked about how our spine has 3 curves, you want to maintain those curves, and if those curves are disrupted, it's going to cause pain. So for our side sleepers, if the height of the pillow is too thin, their neck is going to be bent this way for the whole night, right? It causes a lot of tension in the muscles here. It kind of compresses the joints, and that leads to pain. So that's why it's very important for us to understand what's causing it. Because if we're just treating the symptoms, the symptoms get better for a day or two, but they're going to come back. Yeah, so that's why assessment is definitely important to see what's causing it, what the root cause of the problem is, and specifically target that.
If you suspect that your pillow is the problem, there is a very simple thing that you can do. I'm going to go and bring a pillow so I can show you.
So you presented several more methods of treatment that you do in your chiropractic than
Right.
I have experienced in the past. I cleared away from chiropractors because all the half dozen, all they ever want to do is
Adjust. Yeah.
So by the sound that you offer much more.
For sure. I have actually treated a lot of patients who are not comfortable getting adjusted and we just do manual treatments using soft tissue, so we just work on the muscles. And most times actually pain comes from the muscles, so it really helps in terms of reducing their pain. I was personally afraid of getting adjusted the first time I got adjusted, so I understand where hesitation comes from. But yeah, we want to make sure I never treat all my patients the same way. All my treatment plans are different, and we want to do something that you're comfortable with. So if you think your adjustment is not, you're not fond of adjustments, you can definitely do other techniques, cupping, acupuncture.
Not afraid of your needles at all.
Yeah.
Don't crack my neck up here.
Yeah.
So typically, you'll have pillowcases here, but this is like a pillow that you have. You can roll a towel, a bath towel. I can find a bath towel, so we have our towels which one. But roll a bath towel, okay? Let's say my shoulder is not very wide, right? And Dr. Jooya's shoulder is wider, right? So the problem that I have with these pillows that you buy is that they are all the same size, more or less, right? But we are each different. So you can roll a towel, put it inside the pillowcase up here, okay? And then you sleep on your side, basically. This will, as Dr. Jooya was explaining, so this prevents your head falling from that, like that. Okay? Or if you are in the back, like, your head will not be like that. So this will be a very good test to see if your pillow is part of the problem that causing the headache for you, right? For the most part, Dr. Jooya said it's not just one condition or one factor that causes the headache. You need to deal with it from multiple aspects of it. But I find this very important, and I almost always give this instruction to patients because we're not home all the time. We have some people that every time that I go to a hotel, I get headache. I wake up with headache. That could be the reason for it. And it's very easy. You can easily manage it, and you can make sure that everyone in the family knows that because it's very simple, very practical, and really can save a day.
Yeah.
In
For
many
sure.
times.
Yeah.
Yeah. Yes.
Any other questions?
Probably talk to, we were talking about pillows. So I have a hip condition right now, so the only, a hip condition. So the only way I can sleep is on my right side,
side is not, it's not comfortable for you, is that correct?
Sleeping on my left side, sleeping on my right is really not comfortable either, so at some point through the night, I flip on my stomach.
Yeah, I mean, it's not, if you've been sleeping on your tummy, do you experience more pain in the morning? Yeah.
Yeah, my neck, but once I get going, then it's sort of, I'm okay. Since
Yeah.
it's not work, there's been a lot of weekends.
Yeah, so when there's stomach sleepers, we actually recommend a thinner pillow. You know, it's not the most ideal. Yeah, it's not the most ideal, you know, position, but this is the only position you find comfortable, you know, just make sure you use a thin pillow. And are you experiencing local pain in the hip?
I have a torn tendon that they
Yeah.
can't fix, so it's not repairable. So we're trying to figure out how to fix it or how to, because it's chronic pain, so it's
Okay.
every day, right?
So you have a torn tendon, is that
When I
right?
come visit you, I'll bring you the medical report.
Yeah, for sure. Because there are things that you can do about it. I actually have a lot of patients with bursitis, so basically the local pain on the tendon on this area, and it's actually very treatable. I mean, we can decrease the inflammation, decrease the pain, and that allows patients to be able to sleep on their side. So it really depends where it's coming from. Acupuncture, electroacupuncture is a very effective treatment for that because it decreases the inflammation, decreases the pain in the area. Yeah, so.
Sorry, I have a special like triangular pillow that goes in between my knees, so that I don't have pain in my lower body anymore.
Yeah, that's
I
perfect.
sleep on my side all the time.
Yeah, we actually recommend patients to put a pillow between their knees when they're sleeping.
Yes.
Right.
Special one.
Yeah.
You have a special one. That's mine's
This
like
special one.
contoured specifically. It's like a
That's
three-dimensional triangle.
Yeah.
Yeah, those are available. They can be expensive though, and they start at like $180, $190. A cheaper solution to that is, as Dr. Jooya said, just a pillow. And if you're concerned that the pillow, will move, you can always wrap it with like a Velcro or something like that. So,
Yeah, it won't work if I flip on my stomach though.
yeah, that's for side sleepers.
Yeah.
For stomach, thin pillow, as Dr. Jooya said, and also you can have a pillow under your tummy.
Yeah.
So when you have a pillow under your tummy, you'll be slightly upper, and then your neck will be resting without too much of flexion, or too much of rotation.
Okay.
It's all, as Dr. Jooya said, it's just more of what makes you more comfortable. And move.
Yeah,
Move.
yeah, for
So
sure.
moving is, even if you go on your side for like 2 minutes, 3 minutes, it's a still movement. So before the pain really gets bad, you can always roll. But I would definitely suggest to see Dr. Jooya for the hip. Hip pain, especially what you're explaining, is very easily treatable. Very easy.
Oh, you're welcome.
Yeah.
I'll get a blanket on the lid.
We'll be looking forward to seeing you.
There we go, she comes to visit you a lot, so.
Yeah, I know. She's one of my good patients.
Yes.
I didn't know about the pillow.
The pillow, okay.
If you had mentioned it before, I totally forgot. And I thought, I'm gonna do that.
Yeah,
Try it.
yeah,
I'm gonna try it out and see.
Yeah,
But she
sure.
sleeps with a mask, so that's even worse.
yeah, yeah.
So, yeah, I'm gonna, yeah.
Yeah, I might try that one tonight and see what I'm doing if I stay on my side long enough.
Mm.
I like to ask them a lot.
Yeah. Yeah.
You had a question?
Yeah, with the cervicogenic ones,
Yep.
it's just heating and ice and stuff. Does that just treat symptoms? It doesn't prevent them in the future?
Yeah, I mean, heating is good. It does help relax the muscles a bit, but it's not gonna do magic, you know? But it's definitely effective. It's something that you can do too. If you do have the muscle strain, you can take a hot shower. It helps kind of warm up the tissues, increase blood flow to the area. It does help for sure, but it's, yeah.
I put my head under a cold sink, so
Yeah.
that's like icing, is that? That seems to work better than heat.
So actually, that's a golden question.
Which one is that?
Sorry. So that's a golden question. Some patients ask us, is heat better or ice? And the answer to that is it depends. 50% of patients respond better to icing, 50% respond better to heat. But as a rule,
Is it January or July?
exactly. Like right now, I suggest all my patients to use heat. But in the summer, it's the other way around. But also, as a rule of thumb, if you do have a new injury, if you have an acute injury, there's inflammation in the area, you want to ice the area to kind of reduce the inflammation, to reduce the swelling, reduce the pain. Whereas with old injuries, like tightness in the muscles, heat helps to relax that. Yeah. But again, it really depends on you. If you've tried both, you know, icing is better, works better for you, might as well continue doing that.
New injuries aren't you supposed to alternate? Heat and cold?
Not necessarily, no. Whatever works for you best, really. Yeah.
Yeah, and one day might something may work, and the next day may not.
Yeah.
It's all, you know, just it's a very safe type of pain management. I would go just with what
Yeah.
feels good that day.
Exactly. What you want to do is you want to make sure you're wrapping either the heat pack or the ice pack in a towel and put it in a plastic bag. Right? Put the pack in this plastic bag and then wrap it in a towel to prevent skin burns.
Right.
And also, you know, prevent it from getting too wet. Yeah. Makes sense?
Yeah.
Alright.
How's your headache now?
It's still there.
It's shifted, is it changed back to what it was, but
No, it's actually shifted to the right side of my head, so so now it's here.
Maybe it's because you're kind of turning your neck to look at me. I should be standing in the.
Oh, no, it's
Right
not
here.
so much that, it's just, I think it's the weather of the barometer right now.
Yeah.
So that's what triggers, because I'm coming into the worst time of year for me, so from spring to fall, summer is brutal for me, for my kids, I don't know about anybody else, but that barometer swing kills me.
Yeah.
So if we can figure out.
Yeah, for sure.
I'm not getting as.
I already have a treatment plan in my mind. Alright. Well, it was so nice meeting all of you.
Yes. So you want to be back?
Oh, no, that's for you to keep. There's a summary chart for the headaches, and there's also the stretch routine that we went through together.